right side buccal mucosa carcinoma, and he was operated in 2018 with wide local excision of the primary lesion with 3-dimensional clearance with right side modified radical neck dissection type 2 with the reconstruction using the forehead flap, as you can see. And he presented with later the histopathological report was PT2N0M0. And so he's come for follow-up with complaints of ulcer on the left side of the tongue. As we can see, the mouth opening is adequate and the flap has been taken up well. There are tobacco stains and there is a small, not ulcerative but a lesion in the left border of the tongue which has been by any malignancy.
So we are looking at a new primary.
Yes, a query new primary, sir.
We need to biopsy this. Since he's a tobacco chewer, there is a possibility of field cancerization also. What is field cancerization?
So field cancerization is when there is a diffuse action of the carcinogen or the stimuli on the cancer. So there are multiple microfoci of carcinoma which arises in a mucosa due to the entire epithelium is exposed to the carcinogen and entire epithelium is affected. So there is not just one focus, there are multiple seedlings of the.
So it should be warned against
Tobacco consumption.
yes, and of course the fact that he should report early such lesions, and it's good to put them on antioxidants. Tomato is good, so is carrot. It can be given even the capsules of antioxidants for a good outcome. So that they don't develop another one. This is a neck dissection scar, and I was teaching, it was an S actually.
Yes,
See,
sir.
after healing, it has become a straight line.
Yes,
So if you start as a straight line, then there is a risk, there is a problem.
Contraction.
And there will be a contraction. Now, even now, maybe I could have made a bigger S. So wider the edge, less is the contraction.
Yes, sir.
But this is now it is straightened. So if I had made the incision like this only to begin with, it will be contracting. So it's good to have this is a modified Schobinger's incision only, if you notice.
Yes, sir.
And this triangle is behind where the carotid is. So you've got to be extremely careful when planning it. So don't make a straight line. That will make a contraction. Make an S. Now that S has become a straight line.
Yes, sir.
You want to do that? See the angle of the mouth when we construct it here?
Using the forehead flap.
And we tunneled it from inside. Mukolo?
Yes, sir.
Look, you can see the skin,
Yes, sir.
which has got gradually de-epilated. You remove
There is some hair, sir. Yes, sir.
Yeah, some hair can still be seen. And you can see that the rest of the mucosa looks fine. But there are, even the palate has some leukoplakic patches. Andar rakho ji. So we should warn him against, we should warn him that these things, this can happen. The mouth opening is adequate. मुंह पूरा बंद करो. His overall competence. गिरता तो नहीं ना पानी पीते हैं. So his overall competence is good. So functionally it's fine. And this is a forehead flap. We have tunneled it from inside and rolled on the same, right?
Yes, sir. Thank you, sir.